All right, everyone, this is Delivered, a natural and healthy birth workshop. And we really did that because we see a lot of pregnant moms here in our office, and a lot of them have a lot of questions in terms of, how to have their best pregnancy. So we're going to talk a lot about that today and how we can help you have a natural and healthy birth yourself. But before we get started, just a little bit about me. My name is Dr. Brady Salcido. I'm the goofball in this picture here, and I'm the owner and chiropractor at Vitality Family Chiropractic. And at Vitality Family Chiropractic, we are exactly that. We're a family practice. So we see kids, we see tons of moms who are expecting little ones soon, and whole families that are coming together to stay well through a healthy spine and nervous system. I was recently married to the love of my life, Christy, right there you see in the picture, and she is also our now office manager for our office. So you'll see her when you come into the office as well. And just a little bit of my background, um, we definitely focus a lot on pregnancy and pediatrics, and really that's a lot from my own story, actually. I was born 5 weeks premature, which unfortunately is not all that uncommon in this day and age, unfortunately. But back then it was a lot more uncommon, and I actually got stuck in the canal. And to get me out, they actually used forceps first. We're still unable to get me out, and eventually they moved on to vacuum, were able to get me out. But unfortunately, I was born not breathing, which is kind of a big problem when you try to get into this world. So luckily, they rushed me to the NICU, were able to get me resuscitated, which is why I'm here with you guys today. But unfortunately, that really stemmed a lot of health issues for me as a child and growing up, and there was not a lot of explanation for why I was having a lot of these issues. I had a lot of respiratory problems, allergies, asthma. I was an extremely colicky baby, lots of constipation, gas, difficulty breastfeeding. But even as I got older, I had a lot more respiratory problems with asthma. I had pneumonia, tons of bronchitis, constant congestion, sinus infections, difficulty focusing through school. But to me, that was normal. I just assumed that was just how everybody was. But as I came to find out when I went and saw a chiropractor, because I was playing rugby at the time, and he just showed me how my spine and nervous system were so out of whack, so out of alignment, that it was affecting my body's ability to function as it was supposed to. And it wasn't until probably 3 or 4 months into care that I just had the haze lifted from my eyes, and my life completely turned around. I no longer suffer with any of those respiratory issues, no longer suffer with any of the headaches, all of these kind of issues that I was dealing with. And I was 16 at the time. And so for a 16-year-old, that makes a huge, huge difference for me. I threw away the inhaler, stopped taking the Advil for the headaches, and my life completely turned around. And I told myself I want to help other pregnant moms and kids just be able to have a healthy life from the very get-go. And so we want to help you have a healthy pregnancy, because that's going to help you have the healthiest child possible, which is what every mom wants, right? So let's get started here. First off, what's your goal for your pregnancy? And I have your capitalized because it's very important that we understand that it's your pregnancy. This is your plan that you have set up. So what is your goal for your pregnancy? And I think anytime someone gets pregnant and people are asking, oh, do you wish it was a boy? Do you wish it was brown hair? All these different preferences for our pregnancy. But every mother will tell you our number one goal is to have a healthy baby. Healthy baby. That's absolutely the number one goal. But there are also some other considerations. How about the safety of the child? That's a big one too. Do we want an easy labor and delivery? Absolutely. Who doesn't? But also there's other things like, do we want a natural birth and delivery? Do we want to do it without any drugs? Do we want to do a home birth? Do we want to be born in a hospital? Do we want to have a VBAC? These are all things to consider for your pregnancy, and a lot of things we're going to talk about today are very important action steps and items and interventions to consider in terms of your plan. So it's very important. The more knowledge you have, the more equipped you're going to be able to have your best pregnancy. And it's really important to have a plan. Welcoming a child into this world is an extremely rewarding experience, but that also requires very careful planning and preparation. And pregnancy is not a diagnosis or a condition. I can't tell you how many times we have a first-time mom coming in, and she's just so nervous. She just came from the doctor, and all of a sudden, instead of just saying, we are so excited, we are so happy for you, we start talking about tests, we start talking about ultrasounds, we start talking about, different things that can happen to the baby, worst case scenarios. And I want to let you know that, pregnancy is natural. This is what your body's supposed to do. It's not a diagnosis or condition. And our job here is to help you have your best pregnancy possible and also have the healthiest child possible. So here's my first question to you. What do you think is the biggest roadblock to your plan? There are so many different things that can come into play with this. There's emotional factors, there's physiological factors, there's physical factors. But the biggest one that we're going to talk about today is something called dystocia. And dystocia is defined as an abnormal progression of birth or the labor process. And there's really three types of causes for abnormal progression of the birth or labor process. The first one is going to be medical or technical causes. And this is going to be the interventions that we'll talk about here in a little bit. And also there's emotional factors that go into play there. There's a lot of studies coming out right now that are studying how the emotional or psychological side of things plays through our nervous system and affects our body. And the last one is physical or neurological issues. And so we're going to dive deep into each one of these. But first, let's start off with medical or technical. And these are really going to deal with the interventions that happen during the labor, during the delivery process. And this is such a great quote here. With every medical treatment, there are risks. And a lot of these risks are unknown at the time. And it's really important to understand that you have your plan, because just like anything else, these interventions are incredibly necessary at times and can be life-saving. But the more you know, you'll know what's best for you and your baby and your plan. So you'll be better equipped to know, okay, is this really necessary? Is this what I really wanted for my birth? Or is this not where we want to go with our plan? And maybe we should avoid this. So my job here is to help you feel more equipped to make the best decision for you and your child here. I'm not trying to sway you one way or another. This is just for your knowledge. So the first one we're going to talk about is induction. And induction is used to start the labor that is not starting on its own. And this can be achieved by three different methods. One is the prostaglandin gel, or artificially rupturing or stripping the membranes. And the most common one we hear is Pitocin. And this is a great quote: lacking a natural rhythm, this type of labor can be more challenging without pain-relieving drugs and gives rise to a greater likelihood for further intervention being required. And again, this is for your knowledge. This is so you know. If you're already planning on having those interventions, it's better to know this ahead of time. But if you're planning on having a more natural, drug-free birth, it's important to know what can happen during an induction, because this is going to make it a lot more difficult for you in the long run. So what are some advantages of inducing or using Pitocin? It can be a reliable method of bringing on labor when health may be at risk or past the due date. Let's say we're 43, 44 weeks. That's a long time and we could be at risk. So the induction can help that. Another reason is social reasons. You have family coming into town. They're only here for a week. They flew in from far away. We're getting towards, a day before they have to go. And we really want to have the baby so they can see the baby before they go. Those are some of the social reasons that we find. And again, that plays into timely. But here's some disadvantages as well. It causes nausea and vomiting for the mother. It can be a lot more stressful and painful and tends to have a longer labor. And increased need for drugs, higher rate of fetal distress, because what happens actually, normally during a pregnancy, during the delivery, we want to see waves of contraction. That allows the baby to rest and relax during those squeezing times. But what happens during Pitocin, it actually will do a constant contraction, constant squeezing, which doesn't allow the baby to get rest, doesn't allow him to relax for a little bit to get ready for the next push. So it's a lot more stressful. And due to the vigorous contractions through this type of labor, there's a higher chance that the uterus could tear or rupture as well. The next one here we have is epidural, and this is the classic, give me an epidural when we're in pain. And this is an injection made into the epidural space around the spinal cord that numbs the body below the injection site. So typically this is done on the lower part of the spine, and the lower part of the spine houses nerves going to the reproductive center and also down the legs. So when the injection is made there, it numbs everything basically from the waist down, or from the belly button down. Now, the advantage of this is obviously pain relief, and it can help control high blood pressure, funny enough, and allows for quick forceps delivery if complications are present because you won't be able to feel it. And this allows the mother to be conscious during a cesarean section. So say you're trying to have a natural birth and say we need to have an emergency C-section, most likely they would use some other form of anesthesia and you would not be awake, and you have to come awake later on. But if you have the epidural, they're able to do the C-section while you're still awake. Now, here are some disadvantages of an epidural. Studies have shown that epidural actually slows down the labor and typically requires Pitocin or oxytocic drugs to keep the labor going. Now, essentially what we're doing is we're trying to numb the nervous system. We're trying to suspend that flow of energy from the brain to wherever that's going, and the brain and the nervous system are critical during the labor. That's how the pregnancy is able to progress, is by the brain sending messages to specific areas of the reproductive system, allowing that to continue. So when we start cutting off that communication from the brain to your uterus and all those reproductive organs, it absolutely will tend to slow down labor and make it more difficult. And this is where we get to the mother is disconnected, the difficulty not being able to push. And what happens is that actually will relax the pelvic floor, making it difficult for the baby to turn into a correct position as well. And then last one, and although it's extremely rare, the spinal cord could be punctured, which tends to lead to severe headaches because it does damage the neurology that can last several days to months. And C-section. This has become a lot more common now. The World Health Organization says there's no reason for C-section rates to be over 5%, 5 to 10%, but most hospitals are actually averaging 30 to 40%. I actually called Los Robles Hospital, which is right down the way from us in Thousand Oaks, and they say they average around 33%. Now, there are many reasons why a C-section wouldn't be performed. Maybe it was an informed decision, prolapse, bleeding, emergency. There's many different reasons why C-sections are performed today, and an epidural is usually required for those type of C-sections. And incision is made to the lower abdomen. Basically, they go through the core muscles, they go through the ab muscles in order to get to the uterus and extract the baby. And sometimes what can happen is forceps or vacuum is used in case the baby is really tightly wedged in the pelvis and they're unable to get the child out. Some advantages, really there's only two reasons this is advantageous, really, is it may be the best birth option to support a mother's needs. So if the mother physically is incapable of delivering the baby vaginally, that is one way. And it may be necessary to save the life of the mother or baby, and this is, in the terms of emergency C-section. And like I said, this can be extremely life-saving and it may be necessary. But it's important to know what happens during the procedure, and it's important to know some of the risks involved so that you can take care of that further on down the line. As soon as you know those consequences, the better equipped you are to make the best decision. And also, the better equipped you are to take care of that once it happens. So here are some disadvantages. First off is heavy bleeding. We have to make some serious incisions through the abdomen. That's going to cause some rupture of blood vessels and cause some heavy bleeding. And since it is a surgery, there are risks of infections and blood clots, of course. And what can happen as well, since the baby is no longer going through the vaginal canal, now what we're seeing is that baby no longer gets the molding of the cranial bones. And molding is very important for the activation of the respiratory centers in the brain. And the squeeze of the birth also help expels the contents from the lungs, expel some of that fluid. And what happens is as the baby goes through the canal, the skull bones will actually fold or actually slide over each other so that the baby can squeeze through. And it's very important. And as the baby exits the canal, those bones will then reform and reshape. So when they don't get that molding, they're not getting that initial squeeze, which also helps activate the nervous system as well. So a lot of times we find these children are at higher risk for allergies and asthma, which is obviously becoming much more common nowadays. And this also, having a C-section can cause a greater risk for future pregnancies, because what happens is sometimes is where that incision line is made on the uterus, if for some, for whatever reason, the egg actually implants on that suture, it can make it a lot more difficult because scar tissue is very different than uterus tissue. And the risk of damage to internal organs, obviously, since we're making an incision through the abdomen, and there's 5 times the risk of the mother's mortality, according to a study done by Dr. Jane Morris. So, obviously, this may be very necessary at the time, but it's important to understand our risks, our disadvantages and risks and consequences, not just for you, but for your child as well. And so here's a sample picture. This is why we see so many newborns in our office, especially ones that have had birth interventions used, because you can see just the type of pressure that is put on that neck. This is why we do what we do and why we're so focused on this, because, if this is necessary, absolutely we can correct this once the baby is out. But it's important to know that. But if it's not necessary, this is the kind of stress that babies are being put under, and we're seeing so much more incidences of colic, difficulty breastfeeding, latching, constipation, gas, and a lot of this stems from the birth process. So it's very important to know the consequences so we can correct it afterwards. And forceps and vacuum extraction, and this is where the baby is being extracted from the womb if the mother can no longer push or is ineffective due to other factors or complications. And we tend to find this a lot of times. This can happen with an epidural, because what happens is the mother is no longer connected to the uterus, and she has a difficult time understanding what that feeling is to push. When the epidural is not there, the mother feels the sensation to push. But when there's an epidural, she doesn't feel that sensation, and that can lead to ineffective pushing. So the advantages this can be very life-saving for a baby or mom if the baby needs to be extracted quickly if there's fetal distress and the baby stopped breathing. It's also effective at removing the child quickly from the womb. So the disadvantages of this obviously are it places excessive stress on the skull bones and upper cervical portion of the neck, which contain the brainstem, as well as many other important centers for the respiratory and cardiovascular systems. And the brainstem is a very important critical area for future neurological and immune system development. So a lot of times what we find ends up happening is these kids who are born, like myself, with forceps or vacuum. For me, luckily, I had both. It actually will cause a very poor immune system to develop, and it will cause their immune system to plummet. This can lead to a lot more immune system challenges early on, which can also lead to more ear infections. So for me, I had plenty, and we're seeing a lot of kids in our office as well who have very similar issues. And this can also lead to some neurological issues too if it's severe. And this can also cause damage to the newborn skull, not allowing proper shape and development of their cranial vault, of their skull. And it's very important because the first 2 years of life, their nervous system will actually grow 200%, far more than any other stage of their life. And if those skull bones aren't opening up properly, allowing proper room, their brain and nervous system will not be able to develop properly. So it's very important that those skull bones are properly molded and shaped, and those forceps and vacuum can really alter that. So how does this affect my child? We've talked a little bit about this before, but interventions absolutely increase the risk of your child having some respiratory issues, as we talked about, constipation or bloating, reflux, colic, difficulty latching or breastfeeding issues. Also, we see delayed milestones as well, and just like we talked about, lowered immune system function as well, especially if we have any issues going on with the upper neck towards that brainstem. So now let's talk a little bit about the emotional side. It's not about you. It's about this intimate connection between you and your baby, because you and your baby are actually connected through your central nervous system. So this is one of those things that I always say, mother knows best. And you hear these stories a lot of times when the mom absolutely knows something is wrong, something is going on, because that mom is intimately connected with the baby. And a lot of times that baby's going to feel what you feel. So if you're stressed, if you're anxious, if you're depressed, if you're being constantly negative, your baby's going to feel that because your nervous system is displaying and relaying that to your child. So it's very, very important to de-stress early on in the pregnancy and establish a regular plan to de-stress. It's very hard to de-stress when you're already stressed. So it's important to establish a plan to make sure you de-stress throughout your entire pregnancy. Some of the most common ones many mothers use is chiropractic care, very helpful. Massage therapy, also extremely helpful. Exercise is extremely important. We're going to talk about that in a little bit. And also just laughter and having a positive attitude. That's extremely important as well. It's very important to make sure you have a healthy outlook on life. So also, physical exercise is extremely important. Studies show that women who exercise while pregnant have more energy, more restful sleep, better stress management, and less mood swings. They also gain 21% less weight and have improved attitude over sedentary pregnant women. 80% of women who exercise regularly during their pregnancy gave birth on or before their due date. Moderate exercise increases placental function and growth, although vigorous exercise is absolutely not recommended because, again, vigorous exercise is stressful on the body. We want you to de-stress. And this also helps improve flow of blood oxygen to your baby's brain. Also, it's very important to eat right. We need to eat how our bodies were designed to eat because eating unhealthy is very stressful on our body, which means we need to drink lots and lots of water. The golden rule is half your body weight in ounces. But also, it's very hot outside and you're sweating a lot, you'll need a little bit more. Or if you're exercising regularly, which you should, you're also going to need a little bit more water than half your body weight in ounces. And also, lots of vegetables, vitamins, and minerals. So the prenatal vitamins, absolutely, but also lots of vegetables because those contain the natural vitamins and minerals found in our world. Also, healthy fats, essential for healthy neurological development. This will be your avocados, your flaxseed oil. We try to stay away from the fish oil during pregnancy, but the flaxseed oil and other healthy fats are very, very helpful for neurological development. And also probiotics help boost the immune system throughout your pregnancy, especially if you've been on antibiotics anytime in your life. Probiotics are extremely helpful to start rebuilding that good gut bacteria and help rebuilding a healthy immune system. So here's my next question for you, and this is probably something you may have never thought about before, but what's the most important organ of your body? Many times I hear heart. Heart pumps blood to the rest of the body. Absolutely important. Liver helps detoxify the body. That's also extremely important. Lungs, hey, if you can't breathe, you're not going to live very long. So very, very important. Kidneys also help you filter and get things out of your body. Very important as well. But what if I told you there's one organ that controls all those vitally important organs? And this is the one underneath your hat. This is the brain. The brain controls everything in your entire body. So you can see the brain sits right up top here in the skull. And what it does is it's constantly sending information down through your spinal cord and out through these nerves to every single organ, cell, tissue of your entire body. Now, the brain's also constantly receiving messages from these vital organs back through the spinal cord and up to the brain. There are 7 trillion cells in our body at any given time, and each one of these are sending messages through our nervous system to the brain so that the brain knows how to properly coordinate, activate, and regulate our body at any given time. That's a lot of messages coming in at one time. And all these messages are being sent through our spine right here. The spine is much more than just a sack of bones, ligaments, and tissue. It's actually the protective housing for our nervous system. And that's really the main idea behind the spine is its protection. So anytime we have issues in the spine, that's going to absolutely affect our nervous system, which also controls everything else. So if there's issues in our nervous system, that's going to absolutely affect our health as well. And when the nervous system can function at 100%, that means the rest of your body can function at 100%. And that's essential during your pregnancy. The nervous system is probably the most underrated portion of our body. And especially during pregnancy, it's the most essential. Because when the nervous system gets stressed or disconnected because of something called a subluxation, the body cannot function at 100%, meaning your pregnancy can't be at 100%. And that subluxation is essentially a misalignment of your spine that starts to adversely affect or stress your nervous system. And the nervous system holds the key to an optimal pregnancy. And when a well-functioning and healthy nervous system allows the mother to combat many of these hurdles or difficulties in pregnancy. So for instance, many of our moms in here who have had their pregnancies for many, many months or their whole pregnancy in our office, a lot of them don't experience nausea, heartburn, constipation, low back pain, swelling because they're taking care of their spine, they're taking care of their nervous system, and their body is able to express their health at 100%. And it's just incredible to watch what happens. And here are some other proven benefits of chiropractic care: faster labor. Any mother would want that, right? Optimal fetal position for birth, and also enhances the baby's brain development. So the first one, faster labor. Research has showed that 25% faster labor times in first-time mothers who got chiropractic care throughout their pregnancy, and 39% in women with multiple pregnancies. Who wouldn't want that? It also helps with optimal fetal positioning. So proper pelvic alignment has shown to give the baby more room to develop, grow, and give your baby enough space to position for birth. This leads to a lot less likelihood of breech or other malpresentations. Now, what can happen is when there's not optimal pelvic alignment, it doesn't allow the uterus to open up. And the uterus is shaped like a triangle, with basically the top of, or the point of the triangle being faced down towards the pelvis, and with the two other corners up towards the abdomen. So what can happen is if that uterus isn't expanding properly, the baby will actually turn to get more room, which is up in the upper corners. Also, I'm certified in the Webster technique, which is a very gentle and specific chiropractic technique designed specifically for our pregnant mothers. So we use this on all our pregnant moms, and we've just seen incredible results with this technique on our moms to have the healthiest and safest and quickest delivery possible. And it also helps the development of the baby's nervous system and brain. And a healthier nervous system allow your body to adapt to your baby's needs. So as the baby's growing and developing in the womb, your body's going to know exactly what that baby needs at any given time, which helps the baby grow and develop properly. And research has shown that movement from the spine helps stimulate the nervous system, which helps stimulate the baby's brain development, especially in the third trimester when a lot of that development is taking place, and inner ear development, especially for hearing and balance, and also development of optimal motor functions. Also, this is a side topic here, infertility. This is a big one we see a lot of times in our office that often goes unnoticed most of the time, but we see a lot of this in our office as well. And really the big idea is disruptions in the nerve supply to the reproductive system can disrupt normal function and therefore disrupt or inhibit normal fertility. And this is obviously a very sensitive and emotional issue with a lot of our moms that come in here and a lot of people who are looking to get pregnant. So a big thing we do is we want to analyze and see if the nervous system is being affected. That way we have some more options for our moms who, before they go to in vitro or other options that cost, a lot of money and have a lower success rate, we want to make sure we try all our options first. And it's just been such a blessing for us to be able to help other people and other families start their own family through our office. Just such a blessing for us. And there's been many published studies on chiropractic and infertility. There was a review of research done that showed that 9 out of 11 women during this study were able to conceive within 1 to 20 months of chiropractic care, and as well take that pregnancy and have a very successful pregnancy and start their own families. And just absolutely incredible. And these were women who were struggling with infertility beforehand. We would love the opportunity to be there for your pregnancy and help you have the healthiest and happiest pregnancy possible. So if that's something you are interested, just give us a call here at our office, and I look forward to seeing you there.